Hey everyone, in this video we're going to talk about restless legs syndrome. It's a common and important problem. We have to learn more, so stay with me till the end to learn more about it. Let's get started. Let's start with description. This condition is neurological sleep disorder, which means it's related to brain, nerves and spinal cord, characterized by unpleasant sensations in the legs and a strong urge to move them. The urge increases during periods of rest, especially in the evenings, and this urge may diminish with movements. The peak incidence is 30 to 40 years of age, and females are commonly affected. Women are twice as likely as men to get restless legs syndrome. But people of any age, including children, can have restless legs syndrome. Symptoms of restless legs syndrome may begin in childhood or adulthood, but the chance of having the syndrome increases significantly with age. And these people with restless leg syndrome have unusual feelings in their legs. For example, itching, crawling, pulling, aching, throbbing, or pins and needles. And as we said earlier, powerful urge to move their legs to make sensation go away. But the condition can also happen in other areas like arms, chest, or head. Clinical features are recurrent uncomfortable urge to move the legs that is typically relieved by movement, begins and or worsened with rest. And the symptoms are worse in the evening and at night, and that can cause sleep disruption. Sleep disruption is important, especially for males, because it's known to decrease circulating testosterone levels, and decreased testosterone levels can cause erectile dysfunction. And we have two types of restless leg syndrome. The first one is primary restless leg syndrome, and we have two causes, idiopathic and familial. Idiopathic means cause or pathophysiology is unknown, and more than 40% of people with restless leg syndrome have some family history of the condition. And these people, when it runs in the family, symptoms usually start before age 40. And let's talk about the secondary type. This type is seen in chronic conditions, and commonly iron deficiency or iron deficiency anemia can cause this. And we can also see this end-stage renal disease and pregnancy. There is a link between restless leg syndrome and pregnancy. About 1 in 5 pregnant women will experience symptoms in the last 3 months of their pregnancy. It's commonly seen in the 3rd trimester of pregnancy. Some foods and beverages that contain caffeine may stimulate your nerves and aggravate the symptoms. For example, coffee, tea, energy drinks, and lastly, chocolate can aggravate the symptoms. You should also limit or avoid fattening items such as soda, fried foods, processed foods, and foods high in sugar. And the symptoms can also be aggravated by dehydration from a lack of water intake. In order to prevent this, you should drink plenty of water. The pathophysiology of restless leg syndrome is centered on a couple factors, and those are dopaminergic dysfunction, problems with dopamine, reduced central nervous system iron, genetic linkage, endorphin levels, immune dysfunction, and inflammatory mechanisms. Some conditions can mimic restless leg syndrome. For example, anxiety. Anxiety can cause agitation and leg restlessness that resemble restless leg syndrome. Also, depression and restless leg syndrome symptoms can overlap. Some antidepressant drugs can mimic restless leg syndrome. For example, SSRIs can increase periodic limb movements during sleep and can mimic restless leg syndrome. We're recommending adopting good sleep habits, quitting smoking if you smoke, and exercising regularly during the daytime for mild cases. And many people with restless leg syndrome find that regular and moderate exercise helps to relieve their symptoms. Think about walking, cycling, and swimming. But while some exercise is good, more isn't better. An overly vigorous workout may make the symptoms worse. We have two types of RLS. You remember, primary type is familial and idiopathic, and we're generally trying to treat the symptoms for primary restless leg syndrome. For secondary restless leg syndrome, we're trying to treat underlying condition, underlying cause. Medical therapy indicated in patients with significant functional and sleep impairment. And we're giving dopamine agonists generally for this type of patients, functional and sleep impairment patients. And we're giving pramipexole or ropinirole. Don't use any of these drugs without talking with your doctor. Lastly, let's talk about the prognosis. Unfortunately, restless leg syndrome is a lifelong condition, and that might get worse with age. But some people go into remission and don't have symptoms for days to years. And lastly, keep your doctor updated on how you're doing. If you start to feel worse, they might suggest different lifestyle changes or medications. So that was it. We have talked about restless leg syndrome, and I think that was a great lesson. If you liked it, please push that like button, subscribe to my channel, and see you on the next video.